folks, I think people are still hopping on, but we're going to go ahead and get started. This is a really great turnout. There are more than 50 folks on here as of now, and that number continues to grow. And we have everyone from, just looking at names, we have cabinet secretaries, we have judges, we have friskies, we have physicians, nonprofit executive directors, other folks who work with kids at nonprofits. So I think this is a pretty good crew of people to be talking about these issues with. So the purpose of today's meeting is, I don't really know what to call these things. The purpose of today's Zoom is to get a scan of these macro issues that are affecting kids and families during this time and discuss some solutions that may already be in progress. We're really grateful that Secretary Friedlander is joining us for the beginning of this call. We really appreciate him making time to be here. And as a heads up, some of his senior staff will remain on the call. So not only are we going to be talking about this, amongst ourselves and how will this get communicated, some of the folks from the Cabinet for Health and Family Services will be listening directly. This call will be, or this Zoom will be recorded, and we will share this recording with all of you. And then if you have some teammates that you would like to share this with as well, that's totally fine. Just a little bit of Zoom housekeeping. Everybody is muted, and as folks speak, I will unmute them. But we do encourage you to use the chat feature to ask questions or add comments as other people talk. This conversation is going to be a little bit unusual in that we really probably won't have time to have like people actually talk to have discussion. Also, there's so many people on this that would be really tough to do. But the chat function is set so that everyone can see those messages. So if you have a question, go ahead and put that in, and maybe somebody else on the call can answer that via chat, or one of the speakers can address that. And we will also, we can download the questions and comments that you all have in chat, including all of the puns that Shannon shared at the beginning while we're waiting to get started. So those will be added to kind of the list of questions and concerns that we at Kentucky Youth Advocates are addressing and looking into. So with that, I am going to turn this over to Terry Brooks, who is using Zoom for the second time today. So Terry, I've unmuted you. And yeah, I believe this is a real watershed moment for Terry. So Terry,
it is.
Taking it to you.
Yeah. Folks who know me know that this should represent hope, because the fact that I'm doing anything technologically in a successful way means that miracles are possible. So just want to say that. I, on behalf of everybody at KYA, want to say just thank you for joining the call today. I cannot emphasize enough that we see this as an iterative process. This is literally step one. What we have tried to do is gather a landscape from child welfare and early childhood and K-12 and juvenile justice and economic security. We've tried to listen very attentively to the administration, and we've tried to listen to on-the-ground voices. And what we're really working to try to do is present an accurate landscape around kids and this crisis. As Jesse intimated, what we want to do is then launch sector-based conversations. I can't, really my goal is, or my role is simply to shift it to who I think is the star of the show, which is who is Secretary Friedlander. I assume all of us have heard the great JFK quote that when written in Chinese, the word crisis is composed of two characters. One represents danger and the other represents opportunity. I just have to say that I think that Governor Beshear Secretary Friedlander and the other key players on Team Kentucky get that bifurcated moment. We clearly face danger, but we also face opportunities. And what I most appreciate about Eric is that he is all about finding opportunities for kids in the midst of a crisis. What I would say is that really since he took over CHFS, but especially since this pandemic became so real, all we have gotten from him is access, listening, and great questions. So for kids in Kentucky, I think one of the best hopes we have going is named Eric Friedlander. Eric, I don't want to embarrass you. I don't know if you can blush on Zoom. I will say that you probably are aware that there's more than a few Andy Bashir press conference bingo games going around. And generally the consensus is that the only bingo block missing is Eric Friedlander ties. So with that intro, Mr. Secretary, welcome. I can't thank you enough for joining us and our partners and colleagues today. So we've asked Eric to sort of give us the good word and kind of share his perspective in a brief way. I also really appreciate Eric's commitment to have his senior folks hang with us through the call. My hope would be that we connect with senior leadership in the cabinet after this, talk about what we have heard and how we can go forward together. So, Mr. Secretary, thanks for being here. You, I guess, are getting ready to be Zoomed statewide, so go ahead.
Secretary, you should be unmuted now.
Okay, great, thank you. So first, Terry, thank you for embarrassing me, first and foremost, but also thank you for your leadership here. Thank you for the leadership of KYA to bring us together to talk about the issues that we're facing in Kentucky. We are living in an unprecedented time. What we are facing, we have not faced in a couple of generations. Because I'm a glutton for punishment, I listened to something about the 1918 flu on the way home yesterday. We really are living through a very, very unique time. And it's a time when we think about best practices and what those are, what best practice is now, and I'm hoping to repeat this a couple of times, what best practice is now is how do we not spread the coronavirus? That is kind of the first question we have to ask as we ask the myriad of other questions. The cabinet and state government, I don't think we're not known for moving quickly, but we have in this case. I think yesterday we finished moving 1,300 DCBS workers to work from home. We are going to expand what we're doing with phone lines. We've sent additional information to the field about when do you go out and actually have an in-person, in-home visit. We're raising those standards, meaning that in order to do an in-home visit, we have to have made the decision that something it rises to the level of significant risk to life and health. So we're changing what we're doing, and you all are our partners. We have tried to open up as many things as we can do with telehealth. I wish for the DCBS social workers that we had enough personal protective equipment so that folks could feel comfortable, but there's not enough for hospitals now. So we are continuing the governor says it all the time. He talks about the heroes in the healthcare field, and I always think about the heroes that I'm addressing here, the heroes that I know work for the cabinet. They don't get enough recognition, sorry, and I am tired, but it's something that we do every day that we just don't get recognized for, and how we work with families, how we work with each other, working through this medium, something that's new to all of us. We're those of us who work in the social service field, we like to give hugs. We like to be together. We like to, Terry, we like to share coffee. But it's something that it calls for us to do something brand new. And Terry, I like what you said about opportunity. This is an opportunity for us to learn. What is it that we thought we always had to do that perhaps we don't? How do we connect through this kind of medium in a way that we have not used before, but is really effective for talking to people across the state? These are things that we may have taken a little longer to try. Terry, I'm also consider myself a Luddite, but these are important things that we have to work through together. So the projections are that we're going to go through the next couple of months trying to figure out how to do things that are new. We're seeing unprecedented levels of folks asking for unemployment. We're going to see unprecedented levels of people coming to us for Medicaid and for SNAP, and that's our responsibility to do. I think through the years, as we look at public health, it kind of let some of that infrastructure go. Well, you have to have that infrastructure at times like this. We've downplayed the importance of our governmental systems and how we talk and work together. And actually, I think in some ways we've downplayed some of our objective realities. But now is not the time for that. And now is the time for us to sit down in venues like this and figure out what is the best way for us to work together. With childcare, we're trying to figure out new ways to make sure with CCAP that we're able to support folks. This is going to be true for basically all providers. We've heard from all providers across the state. All their models are changing, and they've changed in 2 weeks. Who would have thought we could have done that? So we hear that. We're going to try to give as much flexibility as we possibly can. Like I say, some of the in-home visits we have tried to back off as much as we can. Certainly court-ordered still is necessary, but we are going to try to be as flexible with you as we can. We appreciate your partnership. We appreciate your understanding as really, frankly, we're making things up on the fly. This is not the way I'm normally comfortable functioning. 30 years in state government, I have a bureaucratic approach to things, and my mind is blown on that. And it has to be, and it has to be for all of us. We have to be able to really be flexible and creative and understanding as we work together. Are we going to make mistakes? Absolutely. Are we going to learn from them? Absolutely. But I think, again, it is an opportunity to see how we can work together and work together differently. So thanks for the opportunity. I hope that, I know I probably didn't answer a lot of questions, but it is, please give us your questions. Please let us know what's happening on the ground, because that's, again, this type of communication is exactly what we need. So thank you. And I'm ready to turn it back over.
Okay. Thank you, Secretary Friedlander. This is Patricia Tennen. I just wanted to thank you. We truly appreciate your open door approach and your willingness to listen to advocates and partner with us. We're really grateful for your continued leadership during this pandemic, which I've heard you keep saying the word unprecedented, and I think that's incredibly accurate. We know it's going to be an incredibly challenging time for children and families, and it's not an easy job, and we're here to support you and work alongside you the best we can. So I'm going to frame the next part of our call pretty quickly. Like many of you, we've been busy trying to wrap our heads around what the impacts of the pandemic will be on children in Kentucky, and how we can continue to support their health, safety, and economic security. So we've also, as advocates, been learning as we go. And alongside you, we've been reading all the listservs, we've been joining the webinars, and we've been trying to touch base with all of you. And that's really the point of this call, is to try to systematize something that we're figuring out together. So we invited all of you to complete a survey. Thanks for your quick responses. We had 43 total yesterday, and I think Jesse shared with you the initial summary of the survey results. I think all respondents in different ways shared the concern that if families are isolated in their homes, there's a greater chance of instability and there are fewer opportunities to connect with each other for social and mental supports. You know, we heard many concerns about mental health, concerns for caregivers and children due to isolation, job loss, financial strains, all the things that I'm sure you all are very much aware of. So what we'd like to do now is kind of go review what we're hearing by sector from a mix of KYA staff and then some of our partners. So what we'll do is we're going to give each sector about 3 to 4 minutes to summarize the major challenges that they're hearing, some actions that are taken thus far, and some initial thoughts around solutions if we'd have identified them. As Jesse shared earlier, we're not going to have time for big discussion today, but we encourage you to ask questions using the chat feature, and we're going to take note of all of those and synthesize and follow up. And just note that everyone's going to be able to see your questions, so that's also a way to get the discussion going. And with that, I'd like to invite Mehet Kalra to get us started.
All right. Hi, everyone. I'm Mehet Kalra here with Kentucky Youth Advocates. So I'm going to be talking about the health and oral health sector in particular. So I've been having communications with the Kentucky chapter of American Pediatrics, Primary Care Association, the Medical Association, Family Health Centers, White House clinics, and various local health departments across the state. Secretary Friedlander mentioned the concern for more personal protective equipment for healthcare providers. So I think a solution there could be having a statewide coordinated donations resource. But there are a few targeted concerns for children and families in particular. So there's a lack of information and guidance around COVID-19 impact on children and reported child symptoms associated with that virus. So I think a helpful tool for pediatricians and primary care providers would be helpful. Also, there's inconsistent guidance around addressing well child checkups, sick visits, immunization, and screening protocols as well. So that's another need that the state has when speaking to providers. As Patricia mentioned, the need for outpatient behavioral health services, crisis behavioral health services, and mental health of students, since they're isolated at home, those are an important need for the state. And we are grateful that the cabinet quickly reacted by providing a telehealth FAQ last Friday, but now it's more of questions related to how do providers utilize the telehealth system? How does the patient also utilize telehealth, especially if there's not stable internet connection? And there's also ongoing provider questions specific to reimbursement as well. Additionally, there's lack of support and follow-up for children who have identified developmental learning or behavioral health needs. So many caregivers for these children don't have tools available to meet the IEP standards and goals. So that's another thing that we need to think about as we move forward. So as we move on to the oral health piece of my portion, we've received really great information from the cabinet and got guidance from the cabinet on what's emergent and not urgent care in the sense of a document that's been shared widely with oral health professionals. We have been connecting with the Dental Association, the Hygienists Association, the both College of Dentistries that we have in our state, as well as other key partners. One thing that we do need as a state is a resource that is similar to the urgent and non-urgent sheet that was created for providers, but also for parents as well. Because again, we do not need to overwhelm the ER right now, especially with the ongoing crisis that we're facing. We need to inform parents that if there's a sustained pain around the mouth or some sort of abscess, that's when you really need to contact a dentist, not just going immediately to the ER, because we know that the ER is flooded right now. Also, prior to COVID-19, there were oral health deserts across Kentucky, but now dentists are making tough choices like laying off employees, closing their office. So we need to get creative on solutions to promote and uplift the dental community, especially the families that truly need those services. Right now, we do know that there's just we could utilize teledentistry, but again, it's going back to those providers that never using teledentistry. How do you access teledentistry? How does the patient access teledentistry? So those are our concerns that I've been hearing, and also some solutions that we're working towards. So I'm going to now turn it over to Mike Hammonds, who's going to be talking about the childcare sector.
Thank you, Mahak, and thank you to our friends at KYA for hosting this conversation. Also want to thank the Secretary for joining us and for the open way we've had access to him and his team. We've had a lot of questions, needless to say, and we've had quick responses and meaningful conversations with his folks, especially in the Division of Childcare and regulated childcare. So I appreciate that. One thing about this crisis, it's clear to me, is it's done nothing to diminish the importance of childcare. As we try to pull away the layers of our work and get to the core, it's clearer than ever that if people are working, they're going to need childcare. So, and they're going to need quality childcare, which means we have to have a good, stable workforce of teachers and staff that will serve the kids in the classroom and work with the families. So our main consideration is, what are we doing for those who do, or that are still working, emergency responders, hospital workers, and the like? How can we serve them? But also, what can we do with for our families and with our families and children while they're at home? We're reaching out to them and trying to address some of the issues, both with ongoing learning, but also address some of the issues that are unique to this situation. We're also concerned about our teachers and how we can support them, and frankly, work with them, partner with them to continue this new work with families, this new outreach through means such as this. And finally, we need to give some attention to sustaining our business model, which is a real challenge. So we reached out to the cabinet, and the cabinet has been responsive in terms of setting up these limited duration centers that allow childcare providers to serve those emergency workers. We're looking to meet whatever demand there is for that in Northern Kentucky, and I know providers are around the state are reaching out with hospitals as hosts to serve those workers. We're also at this point looking for ways, as I said, to work with our teachers to find new ways of reaching out to families. To sustain ourselves during this emergency and to be prepared to open, though, we're going to need funding. We have many ongoing costs that aren't going to go away during this crisis. And the cabinet has been aware of that and worked with us and waiting, I guess we'll get it any time, waiting for federal approval to allow the cabinet to continue paying CCAP payments, child care assistance payments to providers, and parent copays, which parents don't really have the means to pay. We're also asking the cabinet to consider other grants that would help families or help child care centers meet the loss of parent fees, full parent fees. It's not easy, and in fact, it's not fair to ask parents to pay full fee when they're not accessing the child care. But in order to stay in business, child care centers are going to need that revenue. So Indiana just set up a program where grants will be available to centers to access funds to cover those costs. We're also monitoring what's going on at the federal level. There are provisions in the second stimulus package that expands the leave policy, sick leave and family leave that will apply to some of our staff. and the federal government will pay for some of that. We're looking for expansions in this most recent stimulus that was agreed to last night that might provide small business grants. We'll hope that the state will work with us on that to try to get those grants applied to child care centers as a critical work support and a support that's going to need to be in place when we do get out of this emergency. We're also looking to see if this new proposal in Congress will increase unemployment insurance for those staff that we do lay off. The unemployment insurance doesn't pay much, and any additional support that the Congress can offer those workers, I think, will help support them during this crisis. So those are some of the issues that we're facing, and I think you'll probably get into, Shannon, when you come on and talk about some of the challenges that our families are facing. We're trying to understand those challenges that, as I said, were maybe exacerbated by this emergency. And we're all in with you in what BASIC does and what KYA and your many partners do to support families, especially those who are under tremendous stress. So Shannon?
Thanks, Mike. Yeah, you're absolutely right. I think that there's a lot of concerns around, the substantial stress that parents are feeling based on whether it's losing their jobs, having their kids be there all day, every day, which they're not used to because they're either in school or childcare, and dealing with, underlying mental health or substance use issues at the same time. I'm going to give not an exhaustive list of concerns or questions, but basically what I've been hearing. So use the chat function to add in or make comments if there's something that catches your attention that I'm not explaining in a way that really warrants deeper conversation. We want to be able to capture that too. So I'm going to split it because child welfare is very broad. I'm going to split it into 3 different buckets. And the first one is really around concerns about child abuse prevention. As Mike mentioned, and as other folks are well aware, we have kids at home all day with parents who are dealing with stressors that they may have never experienced before in a way that is creating a lot of uncertainty for a lot of folks. And we know that social isolation is a huge risk factor for child abuse to begin with. So I've talked to a couple of forensic pediatricians, prevention providers, Pam with Family and Children's Place, who provides the hand services in Jefferson County. One of the things that our prevention providers are worried about is supporting staff while not providing services or providing reduced services. So they're concerned about being able to maintain and get reimbursement for limited services. And I think a lot of providers across the board are concerned about potential reimbursement issues there. We've also talked about, or I've had questions about, is CPS still doing investigations? I know that they have talked about what that looks like and are doing some screening in order to still do those, but I think some public information around this would be really ideal, just so folks are aware that if they're calling and if they're reporting through the hotline or through the website, that they're still, CPS is still actively engaging in investigations. Again, less eyes on kids in the home or the potential of unsafe childcare. We've got parents who are really desperate and are looking for anyone who can just sit in with their kids while they still go to work because they're working in those essential fields. And you don't have a whole lot of time to screen somebody's background while you're trying to figure out how to deal with this quarantine and go to work. So just, I know that FACEIT will be putting out information about that, but that's a big concern. Co-parenting issues and the tension or stress with those like parenting and visitation agreements. And I'm not talking about foster care. I'm talking about just parents who are separated or divorced who are trying to figure out how to navigate passing a kid back and forth between homes. There's concerns about just risks to health. I know that some of the potential solutions that we've discussed on child abuse prevention is really around checking on families and encouraging folks to check in on parents frequently and being very explicit about what you're doing. So, you know, saying like, I've dropped a casserole on your front porch, or, hey, let's FaceTime at 3 o'clock so we can all get together and connect. If parents don't have an outlet for that stress and frustration and don't feel like they can reach out to folks, that's when it becomes really problematic, which I know everyone is aware of. So I think here it's also finding a balance between the responsibility of the community and the role that DCBS plays in identifying those situations where Child Protective Services needs to be engaged. And I know that there has been some fairly creative solutions for some agencies. Like we talked to Cabbage Patch yesterday. They are having all of their case managers call parents and families at least once a week to do at least that check-in or video chat. So it's just getting creative where you can to make sure that our parents are okay. Some concerns around kinship care specifically is obviously you have a majority of them being grandparents, older adults. They are in that vulnerable category already. So you've got folks who are worried if they contract the virus, being hospitalized and not sure where the kids are going. Are they going to end up in foster care? Do they go to another family member? What does that mean for their supports that they get access to? So I think that there's a lot of questions around that. Also, just visitation. Should they continue the visitations, even if it means risking their own health, because they want to support those relationships with the parents? Court delays and changes. Grandparents not getting any kind of break, same situation for parents. When you are with the kids 24/7, you're getting overwhelmed. And then no access to those support groups that are typically there, like the face-to-face support groups. I know that there are support groups who are getting creative and doing conference calls instead, but sometimes technologically that's not always easy for grandparents and other relatives. And then, so the third kind of bucket is around just the rest of the continuum being foster care, residential, and then kids aging out. I know again that service providers are concerned about reimbursement, being able to provide services for families, case management, therapy, things like that. I know that there's been some guidance out there from the cabinet, but I think that there are still more questions that need to be answered. Again, some workforce issues within residential facilities. I know Abby's on the chat. You know, we've got people who have to go to work and who can't leave those kids unattended because they're in residential facilities. So there's concerns around health there. Visitation for children in out-of-home care. So that's parent, sibling, family members, CASA. If they can't figure out how to do that electronically or virtually, you're starting to worry about diminished relationships and potential disruptions. We don't want to see kids disrupting from placements because they are not able to access their people and their family members. So making sure that we're really stressing ways in which we can do that's going to be very important. Time frames within courts. I know that there's questions around there, and the courts and AOC and CHFS have been working together, but I think there's still some lack of consistency in practice around that. So just maybe some more explicit guidance or regular conversation between those two sectors. And then finally, older youth in care who are in independent living. They're dealing with isolation just like parents are dealing with isolation, and sometimes their coping mechanisms are not always there, and they don't necessarily know who to reach out to, especially if their worker is just not available. So figuring out ways to support them in a way that's creative and helpful is also, I think, going to be really critical to making sure that they stay safe as well. And I know that Sherry is going to be talking about kind of those basic needs and things that Friskies are doing in order to support families. So I'm going to turn it over to her to talk a bit about that.
Thanks, Shannon. I'll start with some of the things that the Frisks are doing to keep supporting their families. And a lot of them a lot of it is centered around food delivery and making sure that families have food, but they're doing a lot of other things as well. But the food delivery part is, I think, essential and really positive because you do have eyes on families and kids. You are getting to see them, not in an extended way, but at least you're laying eyes on, and you can have a short visit with them. They're doing what they call porch visits, where they're not going in the home, but keeping distance and talking with the kids and the families briefly, making sure that they have food. And school districts are doing a phenomenal job of making sure that kids have not only lunch, but breakfasts. And the Frisks are helping with that. And not only with food, but household goods, getting laundry detergent and toilet paper and soap and those things out to families. Keeping the kids at home stocked with school supplies so that they can do the work that teachers are giving them to do at home. They're helping to deliver those non-traditional instruction packets. If parents can't get in to pick them up when they don't have internet access, if they're not doing a lot of things online, they're sending books home. They're putting books home in the food bags, craft supplies and instructions, some STEM lessons, just all kinds of things like that. And something else that they're doing is checking on families by phone and through social media, especially the most vulnerable kids. They're going to work every day. They are going out. They're seeing the kids and the families. They want to do that. This is what, an amazing thing about these folks. They're just amazing. That's all I can say. There's sometimes the districts are saying stay home, and the Frisks are saying we don't want to stay home. We need to be we need to be out there. We need to be seeing those kids and making sure they have things. So some of the problems that they see, especially if the current restrictions, go on for another month or two, would be one, sustainability of resources out there for food. That would be probably first thing. They're concerned about the social isolation, like you talked about, Shannon, of kids and families and the resulting stress and increased risk for abuse and neglect that you talked about. Learning drop-off. They're seeing parents who are frustrated because their kids won't cooperate in doing the work at home, doing their packets. So that's going to be becoming a problem the longer kids are at home. They're just going to, they're worried that there won't be the learning that could be in a lot of homes. Parents are frustrated. There's still folks out there who don't have internet access, or maybe they do, and there's one electronic device for multiple kids in the family to try and do the work that they're sent online. Frisks are concerned that families will run out of their food stamps in a month because they're buying too much food at one time and consuming it too quickly. That's another concern that they have. And mental health. They're really concerned about mental health issues. Coordinator told me that many of the school-based therapists have been laid off, and that some are doing by telehealth, but there's like 3 therapists to cover multiple schools when there used to be, previously were at least 1 worker per school in some areas. So the access to mental health services is cut critically. That's about it. As far as solutions, one thing we have already done at our office is and working with the cabinet on this, who've granted permission, is to relax some rules in our contract with districts as far as restrictions on spending money for basic needs emergency assistance. We do normally restrict that a little bit because we don't want to be the Salvation Army and the sole provider of basic needs in a community. but we have relaxed those rules and relaxed the amount or the percent of their budget that they can, their operating budget that they can use, because they can't do programming. They can't do contract services to bring into the schools. So they have this money, and that's what people need, especially if the community resources are running out. Then we're hopeful that they can use that extra money to help supplement that when there is that gap between the availability of community resources and getting back into normal. So that's about all I have, I think. Anything else that I didn't cover that you think, Guy, that you would like me to?
I think that was a really great summary. You hit so many points on that, Sherry.
Oh, good.
Yeah, thank you for that. And yeah, thank you, and to all the Friskies across the state who are jumping in. So I'm gonna turn it over to Cortney with Kentucky Youth Advocates, who's gonna talk some more about some justice issues. So, Cortney.
Okay.
There you go. Now we can hear you.
All right. So my name is Courtney, and I'm going to talk a little bit about some concerns and some solutions that we've come up with for justice-involved youth. So as has already been mentioned by a few people, there is the continued need for access to mental and behavioral health services, both now and moving forward, and also the continued understanding that not every family is going to have internet access. There have been several partners who have expressed concerns about visitations being cut off and what that means for kids. And then also some people are concerned about how kids who are now at home are going to be faring, especially the kids whose homes are maybe unstable or where there's violence in the home. Within the detention centers, there are some concerns about the kids' routines being interrupted. So with school not being in session anymore and with volunteers not being allowed in facilities, and the volunteers are typically the people who would, do different activities with them, like gardening or facilitating art classes or something along those lines. So I think there's a need for us to get more of an understanding around like who is meeting those needs now, and are those activities still going on? And then an ongoing concern that we've had is really just around the crossover youth or dually involved youth. And so for those who don't know, those are kids who are or who have been involved in both the juvenile justice system and the child welfare system. And so that group makes up about 10 to 15% of the entire DJJ population. So when we think about kids who are being released in a time when we are mandated to socially isolate, that doesn't really bode well for kids who don't have a family or some other type of support system already in place. So constantly thinking about how we can best wrap services around that vulnerable group is really critical at this time as well. So I was able to, the other day, speak with the Department of Juvenile Justice Commissioner, LaShawna Harris, and then also a DJJ youth advocate, Maggie Kruger, about some things that are currently being done in the DJJ system. So currently all the facilities are closed to anyone who is considered a non-essential personnel, and that includes volunteers. All staff members and every youth who is in detention or in one of the DJJ facilities are tested for symptoms every day. If a staff member has a temperature, they're not allowed to return for 5 days at least. There is daily coordinated communication with DJJ administrative officials, and then with staff on every shift, and then leadership in each of the detention facilities about what's going on department-wide. So they are very committed to transparency at this time, and they feel like it helps to minimize the fear of the unknown, but then it also encourages staff to be more forthcoming about any social interactions they've had or any potential exposures as well. Youth can make video and phone calls multiple times a day now, since they aren't allowed to have any in-person visits. So it's they've increased the amount of time that they can spend on the phone, which is good for the kids who maybe didn't have in-person visits before then. And then there are also some facilities that have been letting kids out if they haven't been adjudicated yet, so if they haven't been sentenced. So in McCracken County, for example, there were, prior to all of these policies being put in place, there were about 30 kids that were in the facility, and right now they're down to 11. And so what they're seeing is that only the most serious offenders are actually remaining in the facilities, and everyone else is kind of, at least in that county, has been given the opportunity to like serve their sentence out at home. Also, all of the youth development centers have been given permission to grant early release to any kids who are doing really well and whose sentences are really close to being finished as well, which is great to see, and something that we hope we can see across the state in the next few weeks if it's still necessary. So that's all that we have, and I will turn it back over to Jessie.
All right, thank you, Cortney. So I'm noticing that the group chat is full of several questions and suggestions, which, as I mentioned before, we're going to add those to like the survey responses and keep collecting those. But there's also just some resources in that. So if you work directly with kids and families, like about, I'm assuming that's Kelly, added info about Peace Hospital being open, and there's just some other stuff in there. So I would encourage everybody to read through that just to see the info that is there. So thank you to all of you for providing these updates. Thanks especially to Mike Hammonds, the Vice President of Advocacy with Learning Grove, and Sherrie Martin, who's the Regional Program Manager with the Cabinet Division of FRISCs. And thank you also to all of you who filled out that survey. As you can see, if you all read those results, there was a lot of insight in that survey, and we are working on collecting or kind of organizing that in a way. And thank you to all of the partners who maybe didn't speak today, but did weigh in on the content, especially that the folks from Kentucky Youth Advocates presented. As most of them mentioned, they did outreach to several partners who provided some really valuable information. So between the survey, these conversations with partners, the info that you shared in the group chat, we're also going to send out a follow-up survey. Between all of that, we at Kentucky Youth Advocates are working to compile a list of, kind of a shopping list to take to the administration of concerns, potential solutions, what on the ground folks might be helpful if they haven't already heard that. We are also going to create some kind of online issue tracker. Not sure what that is going to look like yet, but just so you know that if there's a concern and you want to see if someone is taking that to the administration, if it's not you, which I know many of you are already in contact with state leaders, we're going to try and have a tracker that is somehow interactive to have kind of an ongoing communication. Also, I know that some of you are with organizations that have conducted your own surveys. And if you all are willing to share that info, we would love to figure out a way to share that in this kind of learning community here. And as I mentioned before, we will be sending out a follow-up survey just to ask, like, hey, did you think of anything else, whether that's problems or solutions? And then also info about what would be helpful for you. So like, do you want more calls like these, ongoing emails? Would that online tracker be helpful? Just to kind of get a sense of, at least from Kentucky Youth Advocates' point of view, trying to keep folks connected and communicating with one another, and also making sure stuff is being communicated to decision makers who need to know it. So be on the lookout for that. And with that, we are gonna wrap up our call. We'll leave I'll leave the Zoom meeting open for another minute or two. So if you wanna, maybe 2-3 minutes, whatever. So if you wanna add some stuff to the group chat, please feel free to go ahead and do that. Again, thank you all for joining this call. I know all of you are very busy, whether that's working within your organization just to keep your team together, or whether that's working directly with kids and families. Terry, since you're still on the call, would you like to add any final thoughts?
Just really to amen what Jessie said, I also just want to underscore how lucky Kentucky's kids and families are to have Secretary Friedlander and his team in such a creative, proactive, and accessible space. Again, I would just reiterate what we said at the beginning. This will be a marathon. It's not a sprint. We have to embrace the idea of this being an iterative process. And we know that you join us in understanding the imperative call to be a watchdog and a voice for Kentucky's kids. So in the midst of incredibly busy schedules, thanks for taking this time. Watch for next steps. We and Kentucky's kids are counting on you. Thanks. Thanks, Jesse.
Yeah, thank you, Terry. Thanks all of you. And goodbye, everyone. Thank you again. I'm sure we'll be talking more soon.